Former President Biden has been diagnosed with an aggressive form of prostate cancer. Let's use this opportunity to talk about men's health. It's a broad topic, encompassing everything from physical fitness to mental well-being. But today, we're going to focus on a specific area that deserves more attention. Specifically, an issue that many men face: prostate cancer. It's a condition that can significantly impact quality of life, and understanding it is the first step towards taking control of your health. It's a topic that often gets swept under the rug, shrouded in discomfort and silence. Men often avoid discussing health issues, especially those related to the prostate. But the truth is, it affects millions of men and their families. It's not just a personal battle, it impacts loved ones, relationships, and the overall well-being of entire communities. You might be thinking, that's something for older men to worry about. It's easy to dismiss it as a distant concern, something that won't affect you for many years to come. But the reality is, understanding your risk and knowing the signs is important for every man. Can make a world of difference at any age. Early awareness can lead to proactive measures and potentially life-saving interventions. Prostate cancer is one of the most common cancers in men, affecting a significant portion of the male population worldwide. But it doesn't have to be a death sentence. With advancements in medical science and treatment options, many men are able to overcome this disease and live fulfilling lives. Early detection is key. The sooner prostate cancer is identified, the greater the chances of successful treatment and recovery. And the good news is that most men diagnosed early go on to live long, healthy lives. They continue to pursue their passions, spend time with loved ones, and enjoy all that life has to offer. One of the biggest misconceptions surrounding prostate cancer is that it only affects older men. This misconception can lead to complacency and a lack of awareness among younger men. While it's true that age is a significant risk factor, and the likelihood of developing prostate cancer increases with age, we are seeing more and more cases in younger men. This trend highlights the importance of early detection and awareness for all men, regardless of age. That's why it's crucial to be informed about your risk factors, such as family history, race, and lifestyle choices, and potential symptoms, regardless of your age. Recognizing the signs and symptoms of prostate cancer can lead to earlier diagnosis and treatment. Remember, knowledge is power. The more you know about prostate cancer, the better equipped you'll be to protect your health and make informed decisions. By understanding prostate cancer, you're taking a proactive step towards protecting your health. You're empowering yourself to make informed decisions and take control of your well-being. So, let's dive in and learn more. Together we can break the silence surrounding prostate cancer and empower men to take charge of their health. Prostate cancer. It's a diagnosis that no man wants to hear, but understanding the risks and recognizing potential warning signs is crucial for early detection and effective management. Can be a silent threat, often lurking without any obvious indications, especially in its early stages, when treatment is often most effective. The insidious nature of this disease means that vigilance and awareness are your best defenses. Many men don't experience any noticeable symptoms until the disease has progressed, making it all the more important to be proactive about your health. However, there are some subtle signs, whispers from your body might be sending, signals that could indicate a potential problem. Learning to interpret these signals can be life-saving, that you shouldn't ignore. These are red flags that warrant further investigation. One of the most common signs is a change in urinary habits, a shift in your normal routine that might seem insignificant at first. This could mean needing to urinate more frequently, especially at night, disrupting your sleep and impacting your daily life. Experiencing a weak urine stream, a noticeable decrease in the force and flow, or having difficulty starting or stopping urination. These changes can be subtle at first, but they can become increasingly bothersome over time. While these symptoms can be caused by other conditions, it's important not to jump to conclusions. Like an enlarged prostate, benign prostatic hyperplasia, or BPH, a common condition as men age, it's crucial to get checked by your doctor to determine the underlying cause of your symptoms, to rule out anything serious and receive appropriate medical advice. Other symptoms to watch out for include blood in the urine or semen, which is never normal and always requires medical attention. Pain or burning during urination, a sign of potential infection or inflammation, and persistent pain in the lower back, hips, or pelvis. This deep, aching pain can be a sign of more advanced disease. It's important to remember that these symptoms don't always mean you have prostate cancer. However, if you experience any of them, don't delay seeking medical advice. It's essential to see your doctor as soon as possible for a thorough evaluation. Early detection is key to successful treatment and improved outcomes. When it comes to prostate cancer, understanding your risk factors is crucial. While any man can develop this disease, certain factors can increase your likelihood. Age is a significant risk factor, with the chances of developing prostate cancer increasing after age 50. Family history also plays a role. If you have a father, brother, or son who has been diagnosed with prostate cancer, your risk is higher. Race is another factor to consider. African American men are at a higher risk of developing prostate cancer and are more likely to be diagnosed at a younger age. Lifestyle factors can also contribute to your risk. Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity can all help reduce your risk. So, when should you start getting screened? Most doctors recommend that men at average risk begin discussing screening at age 50. However, if you have any risk factors, such as family history or African American ethnicity, you should talk to your doctor about starting earlier. The topic of prostate cancer screening can bring about a lot of questions and perhaps a little anxiety. It's understandable to feel that way. But the truth is, getting screened for prostate cancer is a relatively simple process. It's a routine procedure that doctors perform regularly. And this simple process can provide valuable peace of mind, knowing you're taking proactive steps for your health. It's about empowering yourself with knowledge. The most common screening method is a prostate-specific antigen, a test widely used and easily accessible, or PSA as it's commonly known. It's a simple blood test. This test measures the level of PSA, a key indicator that can provide valuable insights into your prostate health. PSA is a protein produced by the prostate gland, a small gland located below the bladder in men, and the levels of this protein are measured in your blood. Elevated PSA levels can indicate prostate cancer, potentially signaling the presence of cancerous cells. But it's important to remember that they can also be caused by other factors, so don't jump to conclusions, such as BPH or benign prostatic hyperplasia, a non-cancerous enlargement of the prostate, or prostatitis, which is another common condition. Prostatitis, as mentioned, is simply inflammation of the prostate gland. If your PSA levels are elevated, it doesn't automatically mean you have cancer. Your doctor may recommend further testing to determine the underlying cause and rule out any serious issues. This might include a digital rectal exam, DRE, a quick and straightforward examination. Or, in some cases, a prostate biopsy may be recommended for a more definitive diagnosis. A DRE involves your doctor gently feeling your prostate gland. This is done through your rectum to check for any abnormalities in size, shape, or texture. A biopsy, on the other hand, involves taking small tissue samples directly from your prostate. These samples are then carefully examined under a microscope by a pathologist to check for the presence of cancer cells. Remember, the primary goal of screening is all about early detection, giving you the best possible outcome. The earlier prostate cancer is found through screening, the better, because the earlier it's detected, the better the chances of successful treatment, a full recovery, and a return to a healthy, fulfilling life. So don't let fear or embarrassment prevent you from taking control of your health and discussing screening options with your doctor today. If you loved this video, like it, share and subscribe for more health and wealth tidbits.